Thank you, Stan.
So next up, we have along this effort today to really harmonize and continue to talk about digital health and virtual first and what it's doing to the healthcare system is a part of a wonderful colleague of mine. We've been working together for a couple of years now. She's a regular faculty member at the Columbia Business School digital health program, and also in the global compliance office at AstraZeneca. Jessica, welcome today. Thank you for joining us.
Thank you. Thank you so much for having me, and can't wait to get into the conversation.
Yeah, and I think, this hour is really around mental health and wellness, along the lines of what's happening in virtual first today. And I know that's certainly an area of deep interest to you. And maybe just start off by giving everyone a 1-minute overview of your background.
As you mentioned, I'm a global compliance business partner at AstraZeneca. Hard to believe I've been there 27 years, and I've been in the industry for about 30, 35 years. So have had a lot of roles in that. A fun fact, though, about me is I have a true passion about linking people and information together, and I think that has been my common thread. But I have been to 58 of the 63 national parks. So if you ever need a vacation plan, you know whom to reach out to. So.
That's impressive. I know a lot of people who have the national parks on their bucket list to go to all of them, and
Yes, we
that's
just have
that's a big
somewhere.
list, especially some of the ones in like in Alaska and
That's
Hawaii.
right. We have two north of Gates of the Arctic. So,
Yeah, unbelievable.
but anyway, but we'll
Well,
get there.
well, look, I think it's really interesting because we're talking about Cancer Insights was just on with Tarun Kumar, and we were talking about mental health before that with Ellipsis. These are loaded areas, and with a pandemic and COVID, that's going to be another loaded area as well with long haulers and some of these things. And there are just ethical issues abounding today in digital healthcare and virtual first healthcare. And when it comes to mental health, it's one of the big areas where there are so many ethical issues. And give us an overview of what you've seen as digital health has emerged as the most transformational component of what's happening in healthcare today. What are some of the ethical issues that you're seeing, not just Astra grapple with as it rolls out its vaccine with Oxford, but also some of the broader global digital issues that you've seen with the World Bank, the WHO, and groups like that?
Yeah. Yeah, I think the expanding arena of digital health holistically, it seems like it's almost like becoming the perfect storm, right? So we have lived through, we're in this midst of the COVID days, which just put us and catapulted us into a digital immediate environment that we have to have a sustainable business model around. And it even challenges us ourselves of, are we ever going to go back? To, we know we can't go back 100%, but what is that what's the balance even in our business models as a whole? So no matter what function you're in, you're thinking about that, even employees and working on site as an example. But I became interested really, I think, in digital ethics, as a whole. And I've always had this statement, which I've used before, is that just because you can doesn't mean you should. And I use that as like a North Star guiding point for many of the projects that I'm involved in, is just because I think you have to really realize that technology always outstrips the pace of an industry overall. We know that, right? The cycle time, 18 months? And we in pharma in particular is just lagging behind by years. So regulations are not updated and match the speed of technology. So when that happens, we're in a gray space, and we have to almost make decisions by our corporate values, personal values, principle based, because we're in that gray space as a whole. And so I think you have to look at digital ethics from your perspective of doing the right thing, right? And making sure you can, if challenged, you can defend what your choices were. I think it's knowing and keeping in mind your why. And then I think that's how you stay in the safe zone of this, again, exploding digital health arena overall.
Yeah, and just touching upon mental health and wellness data, and again, we're in that hour of the symposium right now, where we're really focusing on mental health and wellness. What are some of the top three, if you will, ethical challenges that you've seen emerge in the U.S. healthcare system or globally around the collection, the storage,
That's
the
exactly
analysis,
right.
the
That
the,
is so
the
right.
dissemination, the
Yeah.
visualization of patients' digital health data, and what have been your viewpoints so far?
Yeah, I mean, that is so top of mind, I think, as you again get into that data. And as I was even listening again to the Cancer Insight, you can imagine as that a very simple workflow, right? But all those data points going between companies, for example. So, what you had said is I look at things around these principles that guide us around transparency, I think first. Are you transparent with the data person that has that data of what you're doing with their data? I think maybe we are getting, sometimes companies get a little sloppy and piggyback on consents. And when you challenge that, if you don't know how you're obtaining consent to use things, I would take a pause and make sure. That's one example of transparency. Another piece I think is maybe the feeling is in the public domain. Everything is the Wild Wild West and free will. You could just scrape it, take it, and do what you want. But in those cases that you had mentioned, we're now getting into obviously sensitive personal information, which requires such a high standard of management within the companies that we're all a part of. So it's keeping that in mind is the differentiation between maybe something basic as your name, again, your address, which is easily identifiable. But what about biometrics data? What about genetic predisposition information? You know, how is that being handled? Is it appropriate to be shared? And so I always drive toward data minimization, only collect and use what you absolutely have to and justify it as well for it. So I think that those are some of my, I'm just looking down for any other little principles that I have in that particular space for it.
No,
I think that's important.
yeah, no, that's spot on, and it's incredible to look at how broad some of even some of the big tech companies in Silicon Valley and Seattle have tried to do really creative things with data extraction, and it's been legal. There's been no issue with it legally, but then when it hits the press,
Yeah.
it really does rub a nerve with the public. It seems in the wrong direction, and I think certainly. People have begun to take notice of, okay, there is a legal level, but like you said, there's also an ethical level that has to do with the value systems of the companies, but also with society. And it looks like we do have this emerging value system within our society that's also a moving target. Correct?
Yes, I think, and what I think is exciting, well, at least what we're seeing the emergence of in this particular space is, as we're probably aware of from a privacy perspective in particular, GDPR, again, a European based privacy approach, is coming to the United States. So, states are coming up, although there's no federal governance over privacy per se, but California being incredibly active, Virginia being incredibly active. So, individuals are now wanting the control of their own personal data for either stopping and selling of it, not sharing of it, and actually deleting it if appropriate from companies. So we're going to be challenged as in the industry on how we do certain things because the control will now shift back to the true owners of the data over time. So
Yeah. And so we're talking about virtual health, virtual first as well on this entire symposium, the whole series. And tell us a little bit more about how telehealth is shaping the future of virtual care, and what some of the ethical issues technology is shaping there through video and through on-site versus off-site.
yeah, I think when I thought about telehealth, so I think that's a great thing because we're probably all even consumers, even as patients, getting exposure to telehealth because not of wanting to go into physicians' offices at this time or having loved ones, having that care. Um, I think that many services are going to be, again, linked in the telehealth space. So I take it as a very broad definition, not just the true authentic video that we could imagine it being, but I think the great service that it provides, again, is closing the loop and making those pulse checks on individuals a lot easier, simplified, again, and I would say in this digital way, maybe again building trust. If you're concerned about your data and the maybe use of data, now again, you'll have video captured, for example, maybe you have recorded, you have your call notes, for example. So all of that again protected under HIPAA. We just have to ensure that we're protecting everything in those interactions. But I think the building of trust will go a long way in the patient-physician relationship.
Brilliant. Okay,
Yeah.
I think that is, and that's going to be an interesting component as we see really the pervasiveness and the diffusion of telehealth begin to take effect. We're going to see more and more issues arise out of that as people from all different walks of life start utilizing it as Don Jones said,
Primary. Yeah.
yeah, as their primary intervention, their primary
Hmm.
interaction before they move into a prescription or a scan or a lab or any kind of bricks and mortar interaction.
Hmm.
And in terms of electronic health records, that I mean, they're also becoming more and more important today, with everyone moving to this virtual first and having their annual physicals now done predominantly online. What are some of the ethical issues that you've seen with the growth of personal health records on the
Yeah.
outside and electronic health records on the integrated side?
Yeah. I think if I had to take so from a patient perspective, what I think is the important part, again, in this digital ethics space is interoperability, right? That hope, again, and almost what we heard from the previous speaker of that exchange of information that it could be exchanged between different healthcare systems, for example. So that makes it possibly easier for the patient if you're seeing physicians in different practices. So how do we make it simple for the patient side? And then when I think about the players involved, so we have a healthcare system that's a covered entity with HIPAA. We might have a business associate representing their interest, and then you maybe have a healthcare, a pharmaceutical company, right? That's forming like a triangle of data exchange in the mix of this. So I think we all have to play our role in payers, add payers into the mix as well. So I think we have to know and stay in our swim lane of what's appropriate. And again, challenge ourselves not to cross the line again into identified information if it's not necessary. So think about how you de-identify information. I heard a little bit about synthetic data, for example. So make conscious choices of the data that you need and want, but make sure maybe in your analysis of it, how does others benefit in that ecosystem that you're living in as well? So EHR is one component of it. Maybe it's self-reported data from a patient that you want to link with EHR, for example, things like that.
I think that's going to be critical. And we've got about another couple of minutes here. Any high level advice or insights that you want to provide the audience now? Again, globally, we've got folks on from Kazakhstan, et cetera, to help them with grappling with some of these ethical issues with digital health as it really expands and explodes during the pandemic.
Yeah, so my piece of advice is, um, our shift to digital almost happened overnight. It was always part of our plans, but it became so cornerstone in this particular past year, right? And I think my advice to you is to keep things principle based because there is no black and white at times. We have guidelines in our industry as a whole. So you have to use those principle based ideas for your decision making. And we see what I think is exciting, though, what we can see is these tactics that we maybe talked about and this view of that patient, that 360 degree view of a patient, of an HCP is coming to life, right? So this concept of omni-channel, for example, figuring out the next best message to those individuals, like delighting them in the space of healthcare is something revolutionary, I think, because we've experienced it in so many things, like again, Amazon and other retail industries, for example. But now is, I think, the time where this collective ecosystem is coming as a whole to make it exciting for patients, HCPs, and all involved in the healthcare system.
So important, and thank you. Just incredibly important. So I think we've got to learn that it's principle based, and really, legal is important, absolutely, and certainly look at the value systems of not just the company but the society nationally and globally. Thank you, Jessica. Always
Yeah.
always capturing new words of wisdom from you, and looking forward to having you at Columbia.